Hello everyone, I am Vaishali Gambhire and I am going to talk on drug excretion. Drug excretion means removal of drug from the body. Drugs and their metabolites can leave the body in urine, bile, sweat, saliva, breast milk and expired air. Excretion is defined as the process whereby drugs or metabolites are irreversibly transferred from internal to external environment through renal or non-renal route. Excretion of unchanged or intact drug is needed for termination of its pharmacological action. Excretion of drug can take place by either renal route or by non-renal route of excretion. Non-renal excretion includes biliary excretion, pulmonary excretion, salivary excretion, mammary excretion, skin or dermal excretion, gastrointestinal excretion, and genital excretion. The principal organ of excretion are kidneys, where products are excreted through urine. Renal excretion involves three mechanisms, namely glomerular filtration, active tubular secretion, and tubular reabsorption, which are basically the mechanism of urine formation. Glomerular filtration and active tubular secretion increase the concentration of drugs in lumen and hence facilitate excretion, whereas tubular reabsorption decreases it and prevent the movement of drugs out of the body. So, excretion rate, that is renal excretion rate, is equal to rate of glomerular filtration plus rate of secretion minus rate of tubular reabsorption. Drugs and metabolites which are water soluble, that means polar, non-volatile and having low molecular weight, that is less than 500 Dalton, and one that metabolizes slowly, get excreted in the form of urine. Factors affecting renal excretion include physicochemical properties of the drug, mainly molecular size, pKa, that is dissociation constant, and stereochemical nature of the drug. Drugs with molecular weight less than 300 Dalton and which are water soluble are excreted in kidney. Another important factor affecting is distribution and binding characteristics of the drug. Clearance is inversely related to volume of distribution. Drugs that are bound to plasma proteins behave as macromolecules and cannot be filtered through glomerulus. Only unbound or free drug appear in glomerular filtrate. So, protein bound drug has long half-lives. Biological factors such as age, sex, species, stain difference, etc. alter the excretion of the drug. Renal excretion is 10% lower in female than in males. The renal excretion in newborn is 30 to 40% less in comparison to adults. Whereas in old age, the GFR, that is glomerular filtration rate, is reduced and tubular function is altered, which results in slow excretion of drugs and prolonged half-lives. Drug interactions play important role in renal excretion. Any drug interaction that result in alteration of binding characteristics, renal blood flow, active secretion, urine pH, intrinsic clearance, and forced diuresis would alter the renal clearance of drug. Renal clearance of a drug highly bound to plasma proteins is increased after it is displaced with other drug. For example, gentamicin-induced nephrotoxicity by furosemide. Alkalinization of urine with citrates and bicarbonates promote excretion of acidic drugs. Renal dysfunction greatly impairs the elimination of drugs, especially those that are primarily excreted by kidney. Some of the causes of renal failure are blood pressure, diabetes, pyelonephritis. Uremia is the condition characterized by impaired glomerular filtration rate, results in accumulation of fluids and protein metabolites, also impairs the excretion of the drugs. Half-life is increased, resulting in drug accumulation and increased toxicity. Let us see non-renal routes of drug excretion. Drugs and their metabolites may get excreted by routes other than renal route, and these are called as non-renal routes of drug excretion. Non-renal route of drug excretion comprises of biliary excretion, pulmonary excretion, salivary excretion, mammary excretion, skin or dermal excretion, gastrointestinal excretion, and genital excretion. Liver secretes 0.25 to 1 liter of bile each day. It's important in the digestion and absorption of fats. Some drugs and their metabolites are excreted by the liver into bile. Almost 90% of the secreted bile acids are reabsorbed from intestine and transported back to liver for resecretion. The rest is excreted in feces. Drugs which are excreted through biliary excretion must have high molecular weight, that is higher than 300 Daltons, and it should have strong polar group. Pulmonary excretion is the uncommon route of excretion where removal of drug takes place in vapor state. Gaseous and volatile drugs such as general anesthetics are absorbed through lungs by simple diffusion. Pulmonary blood flow, rate of respiration, and solubility of substance affect pulmonary excretion. Here, intact gaseous drugs are excreted but not the metabolites. The pH of saliva varies from 5.8 to 8.4. Unionized lipid-soluble drugs are excreted passively in the saliva. The bitter aftertaste in the mouth of a patient is indication of drug excreted through saliva. Some basic drugs inhibit saliva secretion and are responsible for mouth dryness. Compounds excreted in saliva are caffeine, phenytoin, and theophylline. Another non-renal route of excretion is mammary excretion. Excretion of drug in milk is important as it gains entry in breastfeeding infants. Milk consists of lactic secretions which is rich in fats and proteins. Free, unionized and lipid-soluble drugs diffuse passively. Highly plasma-bound drugs like diazepam is less secreted in milk since milk contains proteins. Drugs excreted can bind to it. Drugs excreted through skin via sweat follows pH partition hypothesis. Excretion of drugs through skin may lead to urticaria and dermatitis. Compounds like benzoic acid, salicylic acid, alcohol, and heavy metals like lead, mercury, and arsenic are excreted in sweat. Let's summarize excretion pathways, transport mechanisms, and drugs excreted. Renal route involves three mechanisms: glomerulus filtration, active tubular secretion, and active tubular reabsorption or passive tubular reabsorption. Drugs excreted through renal route are mainly free, hydrophilic, unchanged drugs or metabolites with molecular weight less than 500 Dalton. Biliary route of excretion involves the mechanism of active secretion, and drugs excreted are hydrophilic, unchanged drugs or metabolites or their conjugates with molecular weight higher than 500 Dalton. Pulmonary excretion, the major organ involved is lung. Mechanism involved is passive diffusion, where gaseous and volatile drugs get excreted by this route. Salivary excretion involves the mechanism of passive diffusion as well as active transport. Here, free unionized lipophilic drugs and some polar drugs also get excreted by salivary route of excretion. Mammary excretion involves passive diffusion mechanism where free unionized lipophilic drugs get excreted through breast milk. Dermal excretion involves the mechanism of passive diffusion where again free unionized lipophilic drugs can easily get excreted. Intestinal excretion where drugs are getting passively diffused, and here water soluble ionized drugs can get excreted in the fecal matter. Let us see the concept of clearance. The clearance of a drug is a hypothetical volume of body fluids from which the drug is apparently completely removed or cleared by excretion per unit time. It is used to measure functions of organs responsible for excretion. There is one more term, total body clearance, which explains the excretion of drugs. Total body clearance is defined as the sum of individual clearances by all eliminating organs and also called as total systemic clearance. Renal clearance is defined as the volume of blood or plasma which is completely cleared of the unchanged drug by the kidney per unit time. So renal clearance is equal to rate of urinary excretion divided by plasma drug concentration. Let's have a look on various clearance values, mechanisms involved and examples of drugs. Clearance value of 0 ml per minute describes mechanism where drugs are filtered and reabsorbed completely. Example is glucose. If clearance value is less than 130 ml per minute, drugs are filtered and reabsorbed partially. Example is lipophilic drugs. If clearance value is 130 ml per minute, drugs are filtered only. Example is creatinine and inulin. If renal clearance is above 130 ml per minute, drugs filtered and secreted and there is no reabsorption. Example, polar and ionic drugs. If renal clearance is 650, clearance is equal to renal plasma flow. Example is idopyracet. Thank you.